Hi, my name is Abria Bennett, and I'm a student nurse at the University of South Alabama. Today I'll be performing the nasogastric tube placement skills 9 through 11, 13, and 21. I will first measure my nasogastric tube, going from my patient's nose to the earlobe, and then down to the xiphoid process. I will note that in a normal hospital setting, I would not do this over my patient's clothes. With my measurement secured, I will then use my dog ear piece of tape to hold my measurement, and I'm using this because it will be easy to remove during the insertion. Next, I will coil the ending of my NG tube over my fingers, now releasing it, and I'll be sure to lubricate the first 4 inches of my tube with my water-soluble lubricant. Now coming over to my stimulated patient, I'll make sure that the curved ending is pointed downwards. And what I will do now is I will ask my patient to extend their head back towards their pillow, and I will begin to insert the tube in both gently and slowly. After reaching beyond the nasopharynx, what I will then do now is I will ask my patient to relax and to then flex their head forward. I'll ask my patient to take a sip of their water or to dry swallow while advancing the tubing 1 to 2 inches at a time, rotating at 180 degrees until reaching the marked placement. Now what I will do is I will make sure that I do not push against any resistance or to force the tubing. Okay? Next thing that I will do is I will secure my tubing with my temporary tape against either my patient's nose or cheek, and in this case I'm choosing the cheek. After I have done that, or once the NG tube has reached its marked placement, I will then use my pen light in my tongue blade to check the position in my patient's throat for the NG tube. After I have done that, what I'll then do now is I'll make sure to attach or connect my 60 milliliter syringe, which I do not have, and I will attach it to this ending of my NG tube. Okay? Next thing that I will do is, in the following steps, I would dispose of my clean gloves, perform hand hygiene. For step 21, what I will do is I will demonstrate the discontinuing of the NG tube by checking the order. I will then perform hand hygiene, and I will don my clean gloves, and I will also explain the procedure to my patient. After explaining the procedure to my patient, I will make sure that I turn off any suction that is present. I will make sure to undo any clipping to the gown. And what I will do is I will remove any tape from my patient's nose. I will ask my patient to hold and to take a deep breath. And now I will demonstrate kinking as I remove the tape from my patient's cheek or nose. Now demonstrating kinking back onto itself. I will remove my patient's NG tube both smoothly and steadily. I'll be sure to measure the drainage, perform oral hygiene, and to document. Thank you, and this will conclude my skill.